Hello and good morning. My name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're excited that you joined us today for the Small Rural Health Improvement Program, or SHIP, grant webinar. Here's today's agenda. Go over housekeeping and introduction at the beginning. I will hand it over to Miles Bass, our SHIP Program Officer, to go through the application process and requirements. And then we'll have some questions and answers at the end. Here's our housekeeping for today. Number one, this webinar is hosted in Microsoft Teams. If you're not familiar with the platform, you can find the camera, microphone, chat, and view controls at the menu bar at the top of your screens. The chat option will be open for asking questions during the Q&A session, which is at the end of this webinar. And number three, the webinar will be recorded and will be available within 7 to 10 business days. Additionally, we'll be posting some resources in the chat so you can click on things and keep up with everything that we have today. And with that, it is my pleasure to introduce Miles Bass, SHIP Program Officer.
Hello, everyone. As Chris already said, I am a program officer here at HCAI. I will be your point of contact for SHIP for the duration of this grant. So if you have any questions, feel free to reach out to me after this webinar. But without further delay, let's go ahead and begin this presentation today. A brief program overview. The Small Rural Hospital Improvement Program offers grants to eligible hospitals to support activities intended to improve quality of healthcare in rural areas. The goal of SHIP is to assist small rural hospitals in meeting value-based payment and care goals through investments in hardware, software, and training. The program is funded by the U.S. Department of Health and Human Services, Health Resources and Services Administrations, Federal Office of Rural Health Policy. A brief overview of the hospital requirements. The hospitals must be in California, outside metropolitan statistical areas, or in a rural census tract of an MSA. The hospital must be a non-federal short-term general acute care facility. The hospital must staff 49 or fewer beds. The hospital must meet federal priorities as specified in the yearly application. The hospital may be for-profit, non-for-profit, tribal, and faith-based hospitals. Critical access hospitals are automatically eligible. A brief overview of the funding and award information. The SHIP program year is June 1st to May 31st of each year. Funding and award amounts are announced each year by HRSA after all applications are submitted. Annual award amount is estimated at $13,000. Every eligible approved participant hospital receives an equal award. Continued yearly funding for the program and active grants is dependent on receiving federal funds. In the way of funding priorities, current SHIP funding priorities are MBQuip and ICD-11 coding readiness and/or implementation. Hospitals must submit projects related to one or both of these goals, or demonstrate they are otherwise meeting the goals before selecting other projects. For non-CAH SHIP eligible PPS hospitals, ICD-11 coding readiness and/or implementation activities must be selected before other activities. HCAPS activities may be selected to facilitate MBQuip patient engagement measures. Some important dates to note regarding the SHIP timeline. The application cycle is already open and was open since December 9th of this month. December 16th is this webinar we're having here today. January 24th, 2025, next month, the application cycle will close. March 15th, 2025, work plan edits and corrections are due. June 1st, 2025, the program year start date begins. Please note, due to federal deadlines, failure to submit an application by January 24th, 2025 may result in loss of grant funds for this program year. And a quick note, that note has always been there. We've always preferred a quick turnaround. However, this year, it is very important that We get this information in our work plans to the feds as soon as possible due to a tight turnaround that we have this year that was not here last year. So that deadline is very important of January 24th of next month. Now the application process. The applicants and continuing grantees must complete an annual online application. Applications are submitted through the HCAI funding portal. In the application, applicants and continuing grantees will do the following. They will provide certification or recertification that they meet program eligibility requirements. They will select allowable projects for the next program year. They will complete detailed work plans for each selected project. They will provide a midterm update on projects selected for the current program year. This includes the current grantees only. The funding portal is located at this link that we have provided on this slide. The link will also be available at the end of the slide, at the end of this presentation. After creating your user profile, all new applicants and existing grantees must create a user profile before beginning an application for the upcoming program year. To begin, click Create Account on any page of the funding portal site. When creating your user profile, select Organization for Small Rural Hospital Improvement as your user type. This is an important step a lot of people overlook. Make sure you do select that option. Go ahead and complete the user profile information and click Submit. After creating your user profile, simply click Apply here. Select the Small Rural Hospital Improvement Program 2025 option. Follow the prompt in the pop-up to begin your application. Participant requirements include all hospitals seeking a SHIP grant must submit an application and work plan each year. Hospitals with an existing grant agreement with HCAI must provide a new work plan via the application. Navigating the application, the steps for navigating the application include using the Save and Next button to save your progress and proceed to the next page of the application. Use the Previous button to return to the previous page of the application if necessary. Continuing an in-progress application or viewing a submitted application. Step 1, log into your user account. Step 2, click on the SHIP Application in Progress Submitted tab in the header. Step 3, use the arrow button to open the drop-down menu. Step 4, to continue an in-progress application, click Edit on the drop-down menu. Step 5, to review a submitted application, click View on the drop-down menu. Please note, users cannot edit submitted applications. If edits to a submitted application are required, please contact us. After applications are submitted, HCAI staff will review your application for hospital eligibility and project eligibility. If edits are necessary, HCAI staff will contact you and return the application to in progress so edits can be made. Edits are due by March 15th, 2025. Due to federal deadlines, failure to submit necessary edits by March 15th, 2025 may result in a loss of grant funds for this program year. If no edits are necessary, HCAI staff will contact you to confirm your application. Now, in the way of allowable project categories, I will provide a brief overview of allowable projects. Eligible hospitals apply for funding to assist in the implementation of activities related to value-based purchasing, VBP, investment activities, activities that support improved data collection to facilitate quality reporting and improvement, accountable care organization, ACO, or shared savings investment activities, activities that support the development of the basic tenets of ACOs or shared savings programs. Payment bundling, PB, or prospective payment system, PPS, investment activities. These are activities that improve hospital financial processes. Value-based purchasing includes quality reporting data collection and/or related training or software, MB-QUIP data collection process and/or related training, efficiency or quality improvement training in support of VBP-related initiatives, provider-based clinic quality measures education, alternative payment model, and quality payment program training and/or education. Payment bundling or prospective payment systems investment activities include ICD-11 software, ICD-11 training, efficiency or quality improvement training in support of PB or PPS related initiatives, S10 cost reporting training, and price transparency training. Accountable care organization or shared savings investment activities include computerized provider order entry implementation and/or training, pharmacy services training, hardware and/or software and machines, not pharmacist services or medications, social determinants of healthcare screening software and/or training, efficiency or quality improvement training in support of ACO or shared savings related initiatives, systems performance training in support of ACO or shared savings related initiatives, mobile health and telehealth hardware and/or software, not telecommunications, community paramedicine hardware and/or software and training, health information technology training for value and ACO, including training, software, and risk assessments associated with cybersecurity. Now, as far as the award process goes, HCAI passes completed eligible applications to the feds in April 2025. All eligible applicants are awarded if funding is available. Final awards are determined by the feds after reviewing all applications. HCAI will contact applicants and grantees with award information when it is available. Awards are paid out at the end of each program year after each participant submits a year-end report confirming completion of these projects. As far as yearly program priorities go, the Federal Office of Rural Health Policy announces yearly program priorities. CHIP participants are expected to show that they are meeting these priorities with or without the assistance of SHIP grant funding. For program year 2025 to 2026, the priorities were Medicare Beneficiary Quality Improvement Program reporting, ICD-11 training and software. These priorities may change for each program year. However, applicants will be informed if these priorities change. As far as year-end reporting goes, grantees must submit a year-end report at the end of each grant year, including the following: a detailed description of project progress and outcomes, invoice reporting showing award funds were spent on approved projects, supporting documentation for yearly program priorities. Work plan changes and amendments. Instructions include if your hospital must make any changes to the awarded work plan for any reason, contact HCAI immediately. Participants must submit a year-end report at the end of the program year. This report confirms completion of approved projects. Failure to complete approved projects or to alert HCAI to changes in approved projects may result in loss of award funds. And I have some additional information and helpful links here as well as my email handle that you can reach me at, ship@hci.ca.gov. Very helpful link before I turn this over to Chris is the bottom link here, allowable investment search tool. This is very helpful when it comes to finding a project that works for you and your hospital. That's all.
All right. Well, thank you so much, Miles. As you can see, a whole team that's put a lot of work into this program. We're excited that you have joined us today to learn more. We're going to transition to a question and answer session, and the chat option should be open now and accessible at the menu bar at the top of your screen. If you are unable to access the chat feature or still have questions, you can always email us at ship@hci.ca.gov. We're going to answer all the questions that we get in the order that they're received, and we have plenty of time today to get to all of your questions, but we'll do our best to get to all of them today if we do go long. So, all right, let's go ahead and open up the chat. Let's see if we've got some questions today. This is your chance to ask any questions you have. Hopefully you've read through the grant guide and are, if not, we have all of those resources right there in the chat. You can click on them and make sure that you have them. All right, first question, Tiffany asks, is that HCAPS? Is that how you say that?
Yes.
All right. Do HCAP survey vendor subscription fees still qualify?
Yes. Yes, they do.
All right. Got lots of acronyms in this webinar today.
Yeah.
All right. Thank you, Tiffany, for that question. Let's see, any other questions today? Also, if you need to, if the chat is not working, feel free to raise your hand, and we can also answer questions that way if you need.
Certainly.
Carrie asks, the application says it is only open for testing purposes, and applications submitted before the cycle opens will be marked ineligible.
I haven't came across that yet. Go ahead, Nathaniel.
It's just a bug. The application is open. That language you're seeing there should have been removed. Let me double check that. I can actually check that live. But the application cycle is currently open. Huh. I apologize for that. That language should have been removed. Something must not have saved. You will not see that language going forward, and you're good to go.
Yeah. Thank you for letting us know about that, Carrie.
Absolutely. All right. Good start to the questions. Anybody else have questions today? Again, if you need to, chat's not working, go ahead and raise your hand. I did want to remind everybody that we are recording this webinar, and we will be providing a copy on our website of it within 7 to 10 business days. So if you missed a portion or want to forward it to a coworker, you'll be able to do that. Questions today? Got 40 minutes left time for our webinar, so plenty of time if you do have questions today. If you do find that you just weren't able to think of your questions today and think of one tomorrow or down the road, you can always email us at ship@hci.ca.gov. And we'll be happy to assist you that way as well. But we do really value this time where we get to answer your questions directly. So if you have a question, this is a great chance to ask Miles directly. Is everyone able to access the chat feature? Is there anyone having issues not getting in the chat? If you are, you can raise your hand and we can answer questions that way as well. So if there's anybody that's for some reason, sometimes the chat feature will be blocked by certain organizations' security policies. So if that's happening to somebody, go ahead and raise your hand. We will call on you. Give about another minute here. Looks like we may not have a lot of questions today, Miles. All right. Rebecca, I appreciate that note. Thank you. We definitely encourage you, if you haven't yet, go through the grant guide and all of the additional resources, including that allowable investment search tool. Make sure that what you're planning on is going to be allowed in that. And of course, you're always free to reach out with questions. So, all right. Well, Miles, it looks like we don't have a lot of questions. I think that means you did a really good job. So let's go ahead and let's see. We do have one comment here that the ship link slide 26 isn't working. Is that in the downloaded version, Christine, or is that live on screen that you're having trouble with that? Okay, we'll double check that one, and if we need to, we'll put a fix on that and make that live for you. Appreciate highlighting that for us. All right. Okay, well, if there's no other questions, let's go ahead. Well, here's again the links for you. We encourage you to check all of these out. Again, that allowable investment search tool is the one of the ones that you definitely need to spend some time with. And there is that email again, ship@hci.ca.gov. And let's keep going. Well, thank you guys for the couple questions that we had. And please reach out to us if you do have more. Again, we will have this webinar posted within 7 to 10 business days. We do appreciate everybody joining us today to learn more about the Small Rural Health Improvement Program grants, and we're excited to be able to offer it as just one part of our health workforce development efforts at HCAI. We're grateful for your participation today. Here's some links that we would love you to be aware of if you're not already. Hopefully you know of our website, but you can also follow us on social media. We're particularly active on our LinkedIn page, and we encourage you, if you are a participant in one of our programs, when you do great work or you highlight something on your social media that is related to HCAI work, please tag us. We would love to see those hashtags coming in on our social media feeds as well. And we can go to the next slide here. If you haven't already, we encourage you to sign up to our monthly newsletter. You can go to hci.ca.gov at the mailing list and make sure you click on the health workforce options in that selection menu there, and you will be signed up for our mailing list. If you're having trouble getting a hold of us, you can always call us at 916-326-3700, and again, you can email us at ship@hci.ca.gov. We do prefer the email, and it's the easiest way to get a hold of us, and we appreciate everybody taking the time with us today. So with that, thank you so much for attending. Just a reminder, the application cycle closes January 24th at 3 p.m. And as Miles indicated, that is a very important program in close date. And so we do encourage you to make sure that you have that on your calendar and are working towards that. Thank you so much for attending. With that, we conclude today's webinar. Have a wonderful day.